Hello, and welcome to our professional service project, the Walking Deadlifts. We will be providing adaptive fitness classes to veterans with lower extremity amputations in the greater Pittsburgh area. Before we dive into the details, let us first introduce ourselves. We are all current second-year Pitt physical therapy students, hoping to meet a need in our local community. Our individual roles for this project are listed here. Our group mentor is Emily Barno, a Pitt alumni and a physical therapist with extensive experience treating veterans. Not only did she offer us a lot of valuable insight when we were planning this project, but she also agreed to be one of our supervisors for the adaptive fitness classes that we will be offering, and we are very grateful for her help.
What do? We plan to create an adapted exercise class tailored specifically for veterans with transtibial or transfemoral amputations and are currently using prosthetics. They will be either level K3, which is an independent community ambulator, or level K4, which is an athlete, child, or active individual. The classes will be ran by Pitt DPT students and an overseeing physical therapist in order to create a long-term impact in the Pittsburgh community. The classes will be structured into groups that rotate through 5 stations. Stations will focus on core stability, endurance, lower extremity strength, upper extremity functional reaching, and patient education. The rotating of the groups is to have each student come into contact with every veteran so that they learn how to cue exercises differently based on where each person is on the physical ability spectrum. Classes will be offered 4 times a year and will be held in 6-week increments. Veterans will be able to sign up for multiple classes if they choose to, but they do not have to. Progress will be tracked over the 6 weeks with various outcome measures that test endurance, strength, and gait speed. What are we trying to achieve? Our classes will be focused around core stability, functional ability, lower and upper extremity. During classes, we will make sure to check in with the veterans and the rate of perceived exertion. There will be snacks and waters provided for classes to make sure athletes do not feel dizzy or lightheaded. Lastly, we will perform and educate the veterans on skin checks after activity to make sure that there was no excessive rubbing or pressure on pressure-sensitive areas.
So these fitness classes are an effort to teach veterans new exercises, encourage fitness, and build community. The primary goal is for everyone to have fun while working towards their individual fitness goals. We are going to introduce different exercises into every class in order to keep it interesting for repeat participants. And we are also going to offer modifications to our workouts in order to increase or to decrease the intensity so that individuals of varying fitness levels can participate. Given the high rates of vascular and metabolic diseases, as well as mental health disorders in the veteran and amputee populations, there is an unmet demand for mitigating and managing comorbidities, and exercise has proven to have many physical and mental health benefits. Group exercise is a great way to find community. So another goal of our program is to foster relationships both among the veterans and between Pitt students and the veterans. We believe the students will learn just as much from the veterans as the veterans will from the students. Finally, we hope that veterans can take away valuable pieces of education from each fitness class. We are going to track their progress via outcome measures so that veterans can have a tangible understanding of their improvement throughout the course of the classes. For athletes who wish to continue working outside of class, students will provide individually tailored home exercise programs that will be printed out for the veterans to take home. Additionally, educational pamphlets will be handed out at the end of each class, and they will cover a different topic each week, including the benefits of exercise, prosthetic care, and other fitness opportunities in the Pittsburgh area.
Next, we will discuss how and why physical therapists can help. Physical therapists are uniquely equipped to lead community initiatives with veteran amputees for many reasons, but the few we will discuss is as follows. Physical therapists have a high standard for professionalism. They have the ability to coordinate care across healthcare providers, and they have the vast knowledge of clinical expertise. Not only do they address mobility and strength, but also can provide insight on residual limb pain, gait mechanics, and compensatory overuse injuries. Physical therapists also excel in interdisciplinary teams, allowing collaboration with other professionals that could be on a veteran's care team, such as a prosthetist, social worker, and a psychologist. As we have learned in this course and others in our program, a stronger PT-patient relationship allows for personalized care and understanding of veterans' social and environmental factors. By being able to highlight these needs, they are able to be effective liaisons to advocate and support for veteran amputees by bridging the gap between clinical care and community health. Furthermore, physical therapists foster resilience, confidence, and community, which in turn significantly enhances veterans' quality of life.
The population we chose for our service project is male and female veterans ages 18 and older with transfemoral or transtibial amputations who are living in the greater Pittsburgh area. Amputations are common in the U.S. with 5.6 million people living with one, 83% of which are in the lower extremity. While about 50% of all amputations are of vascular origin, the military community is also at high risk for traumatic amputations from occupational hazards. There are approximately 190,000 veterans in the Pittsburgh metro area, and 91,202 of the veterans are served in the Pittsburgh VA healthcare system, which includes 2 hospitals and 6 community-based outpatient clinics. A portion of this population also receives healthcare services from the University of Pittsburgh Medical Center, also known as UPMC. UPMC Mercy Hospital has an amputation rehabilitation program and therapists who specialize in prosthetics. In an effort to better understand the needs of this population, we conferred with Lisa, a physical therapist and limb loss specialist at UPMC Mercy. Lisa has found her patients are able to make significant gains in functional mobility throughout their course of physical therapy. The difficulty is maintaining their progress afterwards. Amputees must expend significantly more energy to walk with their prosthetic, and meeting the daily recommended physical activity guidelines are especially difficult. Because amputations due to vascular disease are so common, and nearly half of the individuals who have an amputation due to vascular disease will die within 5 years, daily exercise is paramount. Lisa recommended targeting our interventions to veterans who meet the K Level 3 and 4 criteria. For reference, K Level 3 means that the individual is able to navigate the community independently, and K Level of 4 means that the individual is active, an athlete, or a child. The veterans in our project face significant challenges that affect both their physical and mental health. Many struggle with access to health care that is tailored to their needs, which exacerbate existing health conditions like cardiovascular disease and osteoarthritis. Additionally, the adjustment to limb loss itself can lead to mental health challenges such as PTSD, anxiety, and depression. These struggles are often exacerbated by social determinants like isolation, limited physical activity, and insufficient healthcare resources, which hinder their reintegration into society and contribute to long-term health issues. In addressing health disparities, physical activity is a key solution, providing both intrinsic and extrinsic benefits. Exercise helps manage comorbidities like cardiovascular issues and osteoarthritis as well, while fostering a sense of belonging in a community. For amputee veterans, exercising with peers who share similar challenges not only improve physical health, but also strengthens their emotional well-being by reducing feelings of isolation. Through structured rehabilitation programs that focus on individual goals, our veterans are empowered to improve their physical and psychological health.
PIT DPT students will lead 2 one-hour adaptive fitness classes each week. 6 to 10 students and up to 30 amputees will participate in each class with supervision from a licensed PT for around a 3 to 5 to 1 ratio. Because DPT students will have the opportunity to apply their clinical skills while teaching and learning from the amputees, these classes will fulfill a community engagement requirement for their DPT degrees. The students' role is to be coaches and motivators. providing cueing and modification. During weeks 1 and 6, we will focus on data collection and outcome measures, as discussed earlier, and a short exercise class. During weeks 2 to 5, we will run a HIIT-style class with stations that focus on elevating heart rate with walking, minimizing fall risk with balance variations, hip extension, abduction, adduction, strengthening with squatting, lunging and deadlift variations, quadriceps, hamstring strength for transtibial amputees, floor transfers, functional activities, stretching to prevent contractures, increases in range of motion, stair negotiation, weight acceptance on prosthetic limbs, and upper extremity core strength. Students will offer modifications and progressions at each station so athletes will be appropriately challenged, as well as provide visual and tactile cueing for proper exercise technique. Throughout the classes, we will offer plenty of rest breaks for hydration and recovery, as amputees tend to have difficulty with temperature regulation.
Here is a sample of a typical class layout for the HIIT-style workouts that will take place in weeks 2 to 5 of each program, with modifications and progressions for each exercise. After veterans have had the chance to ask questions or report progress on their home exercise programs, students will lead the whole class in a dynamic warm-up to increase heart rate. This will consist of active stretching with exercises like jumping jacks, lunges, shuffles, high knees, and arm circles. Then, veterans will be assigned to a station and rotate in a clockwise direction. Each station will be targeted to areas where many amputees have deficits, as muscle attachments are not the same as they were before the amputation, and amputees have increased difficulty generating the same level of force. For example, bird dogs will improve core strength, deadlifts will improve hip extensor strength, which is especially important for knee stabilization during gait and transfemoral amputees. Balance exercises like the Bosu balance will improve ambulation over uneven surfaces. Monster walks will improve gluteus medius strength, which is a key muscle for hip stabilization. And squats will improve functional mobility, like getting in and out of a chair. The cool-down will consist of slow, static stretches with a special focus on hip and knee flexion, and hip abduction in transfemoral amputees, because these are the most common contractures. Quad, hip flexor, and hip abductor tightness will interfere with gait using a prosthesis. Educational pamphlets and snacks will be passed out at the end of each class.
These classes will be held at the Box, 425 Cinema Drive, Pittsburgh, PA, 15203. It is easily accessible by bus, as well as a central location for DPT students and residents of Southside and Oakland alike. This facility has agreed to accommodate individuals with disabilities, and there are 2 parking garages nearby with elevators for easy accessibility. Classes will take place in the evenings in order to accommodate DPT students and supervisor schedules, as well as amputees' work schedules. Once an initial list of interested contacts is achieved, a Google form with potential meeting days and times will be sent out in order to schedule the classes that the participants can make it the most.
Our major source of funding will come from a GoFundMe where we will raise approximately $8,000 to $10,000 as our goal. This will be used to cover all the costs associated with advertising, marketing, and operations of our service. We will be partnering with the PIT DPT program to create a community engagement opportunity for the first and second year DPT students as well. We will also utilize the equipment that the department has to create some of the exercise stations discussed earlier. We will also be reaching out to companies like Three Rivers Adaptive Sports to provide information about different various adaptive sports and activities for these patients to do outside of our classes. And we will also provide referral information to other healthcare providers such as prosthetists, mental health, dietitians, personal trainers, support groups, and we can do this through the Amputee Coalition so that our patients can get all the resources that they need for their recovery.
To ensure we reach the right audience, we've developed a comprehensive marketing plan. Partnerships are at the core of the strategy. We're working closely with organizations like the Pittsburgh VA Healthcare System and UPMC's Amputee Rehabilitation Program, as well as groups like Disabled American Veterans and the Wounded Warrior Project. These partnerships give us access to networks of veterans who can benefit most from this program. We are also relying on trusted professionals like Lisa Franz and Emily Barno to share program information with their patients and colleagues. We'll also engage in local advertising, distributing flyers and posters in VA hospitals, gyms, recreation centers, and physical therapy clinics. Social media will play a big role as well. Platforms like Facebook and Instagram will help us reach veteran communities, local health enthusiasts, and amputee support groups. Through these efforts, we aim to build awareness and excitement about the program. Peer-to-peer promotion is a vital part of our strategy. Veterans who complete the program will be encouraged to share their experiences with friends, family, and their wider networks. This approach not only builds a sense of community, but also creates a welcoming atmosphere for potential new participants. By combining these efforts, we're confident we can build a strong and sustainable base of participants for the walking deadlifts. 15 minutes will be allotted for questions about the educational pamphlet or individual home exercise programs before the athletes begin the 1-hour class. Participants will be able to subscribe to weekly reminder texts and/or emails. Surveys will also be sent out after each class so participants can provide anonymous feedback and suggestions, and DPT students can be continually improving.
Thank you for listening to our presentation as the Walking Deadlifts. Here are our resources.